Hello, how are you doing? It is me again, right in your face. Like I said, I'll be with you wherever, as long as you need this information. I'll be with you right in your homes, in your schools, in your learning center, at your table, exactly in your pocket. Yes, my name remains Bella Abidako, and I'm here with the OSCE exam information. Today, what are we looking at? Drum roll. Assessment. Yeah, so assessment is one of the compulsory stations. When I teach, I tell the candidates, I'm like, I don't like people failing assessment because it's like this long station that never ends. Okay. And the thing we need to know about assessment is assessment could be of various setting. Now, it could be a hospital setting or it could be a community setting. The community setting could be either at the patient's home or at a care home, and that's what you call like a community setting. Now, this means that you could have either the hospital nurse visiting the patient's bedside or the bed space, or the community nurse going to see the patient in their house, okay, or the nurse visiting the patient's room space in a care home, right? These are the various scenarios we could see. However, it is important you understand and read your scenario very well. Now, what I like candidates know is that if there is something you don't understand when you have read your assessment scenario, just before your time starts, when they tell you, hey, your time starts now, before they say that, if there's anything you don't understand, if it looks like it's quite ambiguous, right, just ask a question. Sorry, assessor, please, if you don't mind, can I read this again? Or what does this mean? Hey, they are not there to make you fail. They are there to help you get through with your OSCEs. However, you have a role to play. You have to speak. You have to ask questions, right? So for those people who like to play, oh, I'm so quiet, I don't like to talk. No, 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 no. The OSCE exam is not where you play quiet. You need to ask questions. Why? Because you need to understand your scenario. Now, your scenario is like your guide, is your instruction that tells you what to do next. So it's either saying go to the patient's home and carry out observation, checking the blood pressure, temperature, pulse, respiration, and all of that. Or is saying you're a nurse working in XXX care home. You have a patient who is 76. When you read your scenario like that, or when it's read to you, you understand that is a community setting. Okay, we can't mix these things up. It's quite important we understand the scenarios. And again, something important we all need to know concerning assessment are we have already made up 12 scenarios. Now, these scenarios are like the diagnosis, and they are all listed in the NMC site, or if you say maybe the test center. When you go to the site, you see where they write something about the OSCE timings. You would see all the scenarios. You have them ranging from nutrition assessment to homelessness to cardiac heart failure to end of life, dementia. Those are the new ones. So we've got some new ones. We've also got some that have been existing. Asthma, pneumonia, and a whole lot of them. You need to familiarize yourself with this diagnosis. You need to read them up at your spare time. What this just helps you do is it helps you understand the signs and symptoms you see and how best to manage this patient. Now, when you understand how this works, it's all connected. You then know how to care for the patient, and now that brings you to planning for this patient. Okay. Some new scenarios were just added as at end of 2021, and this, sorry, not 2021, I meant the end of 2022. So these scenarios are dementia, homelessness, end of life. I think those are the three scenarios that have been added, and candidates have been tested on these scenarios. So you need to familiarize yourself with a homelessness, condition, what's likely to happen, and end of life care. If you're a nurse in your own country, how do you care for the patients in their end of life phase? Okay, now let's note that it may not work like it does in your home country. So your best bet is to read in the UK, or read the UK textbooks, or watch their videos, all their scenarios, or read something about end of life. How are the how are the patients treated here? How do they involve their relatives, their family, their friends, their wishes? For what I found out here is they don't joke with pain levels of their patient. So even if the patients are dying, they don't joke with the pain level. Now, that's one of the things you want to look out for, to make sure when you come to your care plan, you will plan properly for that. So what this video has just covered today, it has covered the assessment station, which are the assessment scenarios, all the diagnoses which you are likely to come across in your exam. I know I said there are 12, however, you'll only be asked just one of the scenarios. Yeah, that's how it goes. But you need to, familiarize yourself with all of them. Okay? In the next video, I'll be talking about the documents we need for assessment. You don't want to miss this, because I'll also be talking about mistakes to avoid. It's quite important. So please join me. Again, before I go off, if you are not following me, please do that. Click on the like button and subscribe. You get more and loads from me coming from your Osce trainer, Bella Global. See you later.